let's discuss some topics. Surgery NEET PG 2019. Now, this question is extremely important, like what type of knot is found. There was a given image and reef knot, square knot or surgeon's knot. The answer is reef knot. Okay. Next question is which drug causes bladder cancer, and that is cyclophosphamide. So you have to remember the name cyclophosphamide. So proportional to the duration and intensity. Now, what are the types of bladder cancer? One is non-muscle invasive bladder cancer and there is muscle invasive bladder cancer. You have to remember the types. So muscle invasive bladder cancer undergoes TART, that is transurethral resection of the bladder, cystectomy along with urinary diversion. So procedure and lymph node dissection plus minus neoadjuvant chemotherapy. So non-muscle bladder which we TART followed by intravesical chemotherapy with mitomycin or epirubicin. Next is most common site of branchial cyst location. So branchial cyst is located in the junction of upper and middle third of the sternocleidomastoid, right? So Dollmann's procedure হচ্ছে কি Zenker's diverticulum. Dollmann's procedure, Zenker's diverticulum, right? So endoscopic septum approach, right, can be used for diverticular between and 5 cm in size. So parathyroid gland post surgery is commonly transferred to the brachioradial surgery. In case of retrosternal goiter, the incision is given through the neck. Now, along the upper border of the lower lip, right? So along the upper border of the lower lip, the intercostal drainage is placed. Next is stab knife as a triangular shape with right edge of sharp pointed tips. So incision and drainage of abscess, insertion of drain. What is the size of the blade? That is size 11. Okay, size 11. So which organ is least vulnerable to blast injury? That is liver. Liver is least vulnerable to blast injury, so of physical trauma and resulting in direct or indirect exposure predominantly cause damage, right? So solid organs are the most resistant to blast injuries as the parenchymal disruption and requires very high levels of. So what is there was an image and a punctum was there, so that is basically sebaceous cyst. Now face, scalp or dark color